My name is Laura Cahill and I am a qualified music therapist. I would like to give you an insight into what is the growing profession of music therapy. If I were to tell you I was a musician, you would understand what I basically do. If I were to tell you I was a therapist, you would also understand what I basically do. Music therapy holds the ability to treat a variety of people in different situations using music as the therapeutic medium. Our stand as a practice are just as clinical as any other therapy or healthcare profession. Today, my aim is to increase your understanding of what music therapy is and to consider the history of music and its therapeutic nature. Music therapy is the use of music in clinical, educational, and social situations to treat clients or patients with medical, educational, social, or psychological needs. It is a scientifically based intervention which helps clients achieve a healthy mind by promoting well-being, confidence, and communication through the process of playing music. The music therapist is primarily working with the non-musical needs of the client and their therapeutic needs. Participation in active music making is the method by which music therapists are trained to engage and treat clients. This establishes a musical relationship with the client through which he or she will be able to help them understand the nature of their problem. Music therapy relies on an equal term relationship between therapist and client and the development of trust. A person-centered therapist greatly values the therapeutic relationship and accepts and respects the client's ways of thinking and perceiving and relates to the client on a feeling level. Over the last 50 years, the profession of music therapy has developed as a clinically applied treatment administered by trained professionals. Music therapy is now accepted as a discipline alongside other paramedical professions such as physiotherapy, occupational therapy, speech therapy, and psychology in paramedical services and special educational services. Music therapists therefore work as part of a multi-disciplinary team alongside other professionals. Music therapy is now established as a scientific, evidence-based intervention. Here are just some examples of societies and associations around the world which conduct research and present publications on a regular basis. Referral criteria for music therapy, like any other therapeutic intervention, should be formulated in an appropriate way with different clinical areas and then clarified with the rest of the multidisciplinary team or school department. In the field of education, and particularly special education, referral criteria may be more closely identified with educational and developmental goals. Following a diagnosis, here are examples of criteria for referral and needs that will be met by music therapy. The role of communication within the multidisciplinary team cannot be underestimated during this process. In a school, for example, this could typically involve a class teacher, school principal, educational psychologist, classroom support assistants, and a music therapist, or the therapeutic intervention being recommended. For centuries, music has been used as a therapeutic tool, and ancient healing rituals include sound and music have survived in many cultures. There are numerous examples of the curative and healing powers of music in the historical records of different countries. Music is one of the longest-standing, self-prescribed therapies in history. Music surrounds us, it is everywhere we go, and it is incorporated into our everyday lives. Music influences body, mind, and spirit, and it reflects universal principles of life. Modern music therapy, theory and practice, at all three levels, makes it possible to reconsider the old ideas and give them a new framework. Music can therefore be experienced, understood, and analysed in many different ways. The study of the emotional effects of music goes back to some of the classical experiments of music psychology. It is important to remember that not everyone responds to music in the same way. Music creates mood environments to which we respond at a subconscious and non-verbal level. Music therapists can therefore observe and evaluate these responses as part of their understanding of the client. The process of moving from one mood or emotion to another is part of the skill of the musician, composer, and certainly the music therapist. The mood of the music often needs to reflect the emotional state or mood of the client to begin with before the subtle process of movement can occur. Thanks for listening, and if you would like any more information, please see my contact details below the video. Thank you.